Good afternoon. It's Dr. Trudy Ufundu of Snowspirations Global Health Solutions, and it's another weekend, another opportunity to conduct our word round. So thank you so much for coming this afternoon. My name is Dr. Trudy Ufundu of Snowspirations Global Health Solutions. So thank you and welcome. I hope you're having a wonderful weekend. I hope you're finding time to relax. And I also hope you're learning one or few things about your body. So once you come in, please let me know who you are. Introduce yourself. Tell me where you're located. And as soon as we have a good number, I'm going to start. My name is Dr. Trudy Ufundu. I'm the convener of the group. Now, there are a couple of ways you can participate in today's word round. You can go to our YouTube. Currently, we have a promo for our YouTube. So there's actually an opportunity for you to attend our event tomorrow free of charge. All you need to do is to go to our YouTube, click on the YouTube, subscribe, like, share, then you answer the question about what ovulation is all about. Once you can perform these three basic functions, you might be shortlisted for the event tomorrow. Tomorrow is our big event. We're going to talk about fibroids. We're going to talk about clomid. So if you don't have the resources to attend the event tomorrow and you need to attend, please go to the YouTube. Find Snowspirations Global Health YouTube channel. Click on it, subscribe, like, then provide me the feedbacks of what ovulation is all about. We are gonna award a couple of awards to people to attend the event tomorrow free of charge. Event tomorrow can shape your life, can shape your family. You need to be decisive. If you have fibroid, you need to be decisive. You need to know the type of fibroid you have. You need to know the implications of the fibroid you have. You need to know if your fibroid can affect your fertility. You need to know if your fibroid can lead to miscarriage. You need to know if your fibroid can damage your tubes. You need to know if your fibroid can damage your womb. There are so many things you don't know. And unfortunately, if you're a woman in your reproductive phase and you're an African or you're African or American, just once you're a Black woman, you already have the risk factor of developing fibroid. So please come, let's fellowship tomorrow so you can get the real meat of what fibroid is all about. Now, also tomorrow, we are going to talk about clomid. So I'm going to take care of the clomid. My guest presenter will take care of the fibroid. It's an event you don't want to miss. Now, I understand there are some people that cannot afford the services. We are here to help you, but I want you to participate. How can you participate? Go to our YouTube. Make sure you subscribe. Share our YouTube. Like it. Then provide me the feedbacks of what ovulation is all about. Okay? So when you come in, if you haven't joined the group, make sure you join the group. Admin is providing the links. So join the group. Join the page. Join our YouTube, join our Instagram. Then if you're my friend in Facebook, by default, you can see me right now. So I'm currently broadcasting from our YouTube, from our group page, then my timeline. So if you're in any of those three platforms, this is an opportunity to get feedbacks from me directly. Every Saturday about this time, I provide approximately 1 hour feedback free of charge. So once you come in, introduce yourself, tell me where you're located, then we're gonna get the party started, okay? So thank you for coming. As soon as you can, start asking your questions. Please go and participate in the trivia so you can attend the event tomorrow free of charge. It's very simple. Please go to YouTube, click on our channel, like our channel, subscribe, share, then please provide me the feedbacks. What is ovulation? If you can play this role, then you will have an opportunity to attend the event tomorrow. Admin is already sharing how you're gonna win. So this is the best way we can pay you back, okay? We love giving back. So there is a giveaway. Let me explain how you're gonna participate, okay? Okay. So this is what you're gonna do. If you wanna attend the upcoming Fibroid Clomid Summit free of charge, if you're really in need of the information that will be shared during the event tomorrow, something good is coming. We are awarding 15 free attendance tomorrow. So think about that. So what do you need to do? You go to the link below. You click on this link. When you click on this link, it's gonna take you to our YouTube. When you get to our YouTube, you share the channel, number one. You take the screenshot showing that you have subscribed to our YouTube channel. Then finally, you post the screenshot in the comment section of the post, provide the answer to the trivia. So 3 things: get to the YouTube channel, click like, subscribe, show us the screenshot that you've subscribed, then share that screenshot on the post in our group. Then you will have an opportunity to be shortlisted. This is gonna award 15 people today. The event is tomorrow, okay? Okay, but right now, please go ahead and ask your questions. It's open clinic. Okay, and this lady is actually addressing me properly. Remember, I've changed my name. So I'm now High Chief Elder Dr. Trudy. So she got it right. She might be lucky. She might attend the event tomorrow free of charge. Okay, guys, go ahead and ask your questions now. The clinic is open. The clinic is open. If you are attending the event tomorrow, make sure you have good network. Make sure you have enough data. Make sure your partner is attending. Okay? So guys, the clinic is open. The clinic is open. Start asking your questions. Okay? Please start asking your questions so I can provide you feedbacks. Okay, the first question says, ovulation. Okay, no, my dear, you're not supposed to provide feedbacks now. Don't be in a hurry. Go to the post in our group and provide the feedbacks. Then you will be likely shortlisted, okay? Okay. Okay, guys, keep asking your questions. Okay, the second question says, okay, you just had miscarriage at 10 weeks. Very, very painful. What did you not do right? Unfortunately, my dear, most miscarriages are caused by chromosomal abnormalities. It's not because of what you didn't do right or what you did right. Though there are certain things that might likely lead to loss of your baby before 20 weeks. But in your situation, at 10 weeks, that's about the time miscarriages happen. So miscarriage is the unintended loss of your pregnancy before 20 weeks. If you lose your pregnancy beyond 20 weeks, it's still called loss, but it's not going to be called stillbirth. If it happens before 20 weeks, it's called miscarriage. Unfortunately, it happened to you. Okay, unfortunately. What do you need to do? Book appointment. Go back to your doctor. We need to confirm that you've expelled all the contents of your baby from your body. If you can do this by yourself, you're good to go. Some women, we can give some drugs. Some women, we can also go for what we call evacuation. When we are done with the evacuation, the likelihood you're going to be spotted, the likelihood you're going to be in pain, the likelihood you're not going to be in a good place is very high. What do you need? You need to recover. So give yourself some time to recover, okay? When you're done recovering, go back to the doctor. Let's investigate and see if we can discover the reason why we had this, okay? So everybody that had miscarriage, please take time. Don't be in a hurry to become pregnant again. There are certain things we can identify. If you have infections, we can fix it. If you have hormonal imbalance, we can fix it. If you have cervical incompetence, we can fix it. But there are certain things we can't fix. Number one is chromosomal abnormality. Now, the fact you've had miscarriage in the past can likely predispose you to having another miscarriage if the reason why you had that miscarriage is something that needs to be addressed. So, okay, dear patients, in as much as it's very painful, please make out time, go back to your doctor and make sure your doctor attends to you properly, okay? Okay, guys, keep asking your questions. Okay, let me show this. Okay, When can menses return after delivery, especially if one is not breastfeeding? So there is no fixed time. But here's the deal. Depending on your age, depending on your constitutional factor, depending on the method of feeding your baby. So if you're not doing exclusive breastfeeding, the possibility your period will return back to normal is very high. If you're not overweight, if you're not underweight, the possibility your period will return as soon as possible is very high. So it's individualized. Some women can start having their period as early as 3 months, 4 months, 6 months. Some women, it can be delayed up to 1 year. Now, this is where you need to be careful. Don't wait for your period to return before you will start avoiding sex without contraception. You can quickly become pregnant even before your period returns. So make sure you're ready. Generally, we want women to recover before they become pregnant and have another baby. 18 months. Allow 18 months to pass before you become pregnant. Okay? Especially if you are not doing exclusive, the possibility that your period will return before long, it's high. But you can become pregnant before your period returns. You can ovulate before your period returns. So if you are not careful, especially if you're younger than 35, your partner can get you pregnant again. And it doesn't make sense. Okay, let's continue, guys. What's the cause of no heartbeat in IVF? Unfortunately, when we don't have a heartbeat in a baby growing in your body, that pregnancy is termed non-viable pregnancy. Unfortunately, you've lost the baby. Okay, unfortunately. Now, be careful. You might not have a heartbeat at a particular week. We don't take the decision immediately. What do? We ask you to come back in 2 weeks' time. We are going to repeat our test. If at that 2 weeks and it's still confirmed, we don't have a heartbeat in your baby, unfortunately, you've had a miscarriage. Unfortunately. Okay? So what you need to do, piggyback to your provider. Your provider will give you a repeat appointment. Now, please listen to me. Before you go for evacuation, make sure it's confirmed you had miscarriage. In the past, we have seen women that went with the first test. The fact you're bleeding in pregnancy doesn't mean you're going to lose your baby. But bleeding is a danger sign. So not all bleeding in pregnancy means you're going to have miscarriage or stillbirth. But we want to investigate. So before you come to the decision of going for evacuation, whether you're taking drugs or whether we're looking for an avenue to move the baby out of your body, we must confirm you have lost your baby. And one of the ways we can confirm you've lost your baby is what? No heartbeat. Now, in some women, they will actually be pregnant, but unfortunately, they will lose the pregnancy. When we do an ultrasound, we will not find gestational sac. That's called blighted ovum. It's very painful. Okay? You are on YouTube, but you can't find the link. Then you're not in the right channel. It's very easy. Follow admin, follow the simple instructions, and you will get there. Okay, my dear? Okay, I've already provided feedbacks to that. So let me keep going down. I'll keep providing you guys feedbacks. Keep asking your questions, okay? Please make sure your questions are very simple and straightforward so we can give other people a chance. You're from Uganda. Your question is not related to fibroid. They diagnosed you with adenomyosis three years ago. You don't have any symptoms. The last 2 months, you've had very painful and very heavy period. Those are actually manifestations that might be in keeping with adenomyosis. So please, the best treatment of adenomyosis is dependent on the severity of the adenomyosis you have. Some people might need drugs. Some people will need to surgically correct the problem. So go back to your gynecologist. Okay. A friend went for a scan and she was told the baby is not growing. Unfortunately, it can happen. Okay? Your friend, first of all, should have a very good doctor attending to her. So all pregnant women are advised to be in our ANC group. Please listen to me carefully. When you go for a scan and they told you that your baby is not growing, please, no matter how painful it is, be calm. Seek for second opinion. Don't take that first result and begin to freak out. Go for repeat test. Make sure you're going to a specialist. Make sure the doctor that will interpret the outcome of the scan is experienced. If we confirm the baby is not growing okay, there are a couple of things that can cause that. It can be infection, it can be inflammation, it can be congenital problems, it can be structural problems, it can be chromosomal problems. The ones we can fix, we will fix. Unfortunately, we can't fix everything. So make sure your friend has an experienced OBGYN who can attend to her, okay? Very important. Guys, keep asking your questions. Make sure you go to YouTube. Very simple to join us tomorrow. Very, very simple. Just go click like, subscribe, send screenshot, then tell me what ovulation is all about. Okay, guys? Keep asking your questions. Okay. A thick and faint line in pregnancy test. What does it mean? Pregnancy is all or none. It's either you're pregnant or you're not pregnant. So some people can have faint or partially positive beta HCG. Now, to save yourself the heartache, give yourself 7 days post the period you are anticipating to have your bleeding. So let's take, for example, today is 26, right? If you were anticipating to see your period on 19th of this month, on this day being the 26th, go and run your pregnancy test. If you're pregnant, it's going to show. Now, when you confirm you're pregnant with your urine test strips, don't stop there. Call your doctor, go to the hospital, go for the blood test. When you confirm you're pregnant through the blood test, don't stop there. Book appointment, go for your ultrasound until we have confirmed that that pregnancy is developing inside the womb. That's called intrauterine pregnancy. You are not confirmed pregnant clinically. So this is where you need to be careful. Some women will just be pregnant through the urine and they will go all over the place, telling the whole world. Keep your secrets. Until you've done your ultrasound, you are not confirmed pregnant clinically. Let me tell you why. Unfortunately, some women will be pregnant, but they can miscarry the baby. So they can have missed abortion. They can have molar pregnancy. They can have chemical pregnancy. They can have blighted ovum. They can have ectopic pregnancy. When you have any of these pregnancies I mentioned, it means you were pregnant, but unfortunately, it's an abnormal pregnancy. So don't be in a hurry to go out there in social media to share your secret with the whole world. You are not impressing anybody, okay? So be careful. Okay, let's continue, guys. Keep asking your questions, please. Keep asking your questions, okay? Can someone with diminished ovarian reserve not ovulate every month? Yes, my sister. Not all women ovulate every month. Unfortunately, as a woman, you're not going to be productive to the rest of your life. As you're getting older, your fertility will be reducing. Your ovarian reserve, it's a test that can tell us the quantity and the quality of the eggs you have. Unfortunately, as a woman, as you're getting older, when you come to age 35, your fertility will be drastically reduced. Ovarian reserve means this is your chance of becoming pregnant. So a woman at age 40 has a reduced ovarian reserve. So it's a reduction. It doesn't mean you cannot become pregnant. It means you are going to find more difficulty becoming pregnant. So a woman at 50 can still become pregnant naturally. But the chances of becoming pregnant at 50 is very limited. But so long as we have chance in life, we can succeed. So ovarian test, ovarian reserve test, using some hormones can tell us your chance. So listen to me, my sister. If you are 35, you are considered advanced in maternal age. It means it will be difficult. It doesn't mean it's impossible. We don't have impossibility in this group. We have had women that became pregnant naturally at 48, at 47, at 49, and even at 50. This is the reason why you need to practice PPP. If you notice, I always fly my color. What is the motto of this group? You pray, you play, and you practice religiously. So any woman at any time can become a mother, but your chances of becoming a mother is dependent on your age. Okay, so if you are told that you have poor ovarian reserve, that means you need to act fast. That means you are a candidate for IVF. And if you're going for IVF, if we told you you don't have good results, please consider using donor eggs. Now, let me tell you what will happen if you don't do this. And I'm going to be brutally honest. The opposite of being a mother is not being a mother. If you don't act on time, reduced ovarian reserve will come to a point where you go into menopause. When you go into menopause, you have used all the 400 eggs that God gave you. You can no longer become pregnant by yourself. You will need a donor egg. This is my reality. Now, I understand we are all Christians, right? And I understand some women don't like hearing this. But the fact remains, you can't stop aging. So if you are above 35, and unfortunately, you go for your ovarian reserve test, and they told you you have reduced ovarian reserve, you have to be worried. Be worried for the right reason. Begin to disturb your partner. Begin to see a fertility specialist. Begin to go for IVF treatment. Begin to go for IUI. Begin to plan for surrogacy. Begin to plan for adoption. This is the way you can be a mother in 2022. If you don't act, nothing will happen. Action is the difference you need in this group. Okay? What caused failed IVF? So many things. There are so many factors that can lead to failure of IVF. It can be egg factor. It can be sperm factor. It can be infection. It can be inflammation. It can be the method. It can be the provider. It can be storage. Any of the things I mentioned can lead to failure in IVF. Matter of fact, we have a new PDF. It's a Bible. It's a guide for all the women that will go for IVF. Admin, please, can you share that link for the PDF? Please go and get this PDF. Please don't make the mistake of going for IVF without knowing what IVF is all about. I took time to explain all you need to know about IVF. Okay, so go and get a copy of that PDF and you will know better. Okay, guys, keep asking your questions. Let me see what I have. Okay, make sure you register for the event tomorrow. Deadline is today. Okay. Doc, can you have normal delivery after 2 CS? No, my sister. Now, when you become pregnant, be careful. You see, it doesn't matter how you deliver your baby. Personally, I don't care if your leg is hanging up, if your buttock is hanging left or hanging right. What am I interested in? I want to hear the cry of your baby. And I want to hear your joy. Now, you've had 2 CS. The question is, why did you have 2 CS? The possibility that when you have CS and the subsequent deliveries will be CS is almost 99%, especially in resource-poor country like Nigeria. You do not want to go to a place where they are going to be planning to give you vaginal delivery, and in the course of doing that, you will still end up having CS. So generally, we are very careful. So if you have had 1 CS, the possibility that subsequent delivery is going to be CS is very high. Now, my sister, in your own situation, you've had 2 CS. So why are you even bringing in vaginal delivery in 2 CS? It doesn't even make sense, okay? So just go and get ready for another CS, my dear. Let's continue, guys. Keep asking your questions, please. Okay, Doc, okay? What about a woman at age 35 that want to go for IVF? What is the success rate? Very, very high. Now, not all women will have the IVF option. Now, the question is, at 35, have you tried the natural way? Have you been making love with your partner? Have you been exercising? Have you watched your body weight? Are you eating properly? Are you popping your prenatal multivitamins? Now, if you have done this at 35, 6 months, and you're not able to succeed in becoming pregnant, please escalate to a fertility specialist. A fertility specialist can give you drugs. A fertility specialist can give you IUI. A fertility specialist can recommend IVF. IVF is the top echelon in fertility treatment. So you don't just start with IVF. We end with IVF. So IVF is when every other thing failed. Okay, so you have a better success story with IVF if you're younger. But here is the advantage for women that are older. You might not have a higher success rate of IVF compared to a younger woman, but you have a higher success rate of multiple pregnancy. So a woman that goes for IVF at age 40 can have 3, can have 2, can have 4 babies, compared to a woman that went for IVF in her early 30s. So old age is an advantage for multiple pregnancy. Okay, let's continue, guys. I love all the questions today. So let's see what we have. Okay. What could be the cause of after PPP during ovulation still not pregnant? Because there are so many factors that can lead to inability to become pregnant. If you're doing PPP, especially if you're talking about your ovulation, fact remains you don't know if you're ovulating or not. Some women might think they are ovulating and they wait for day 14. Lo and behold, you've ovulated on day 10 or 12 or 20 or 16 or 18. So we don't practice ovulation sex. Okay? Now, if you are diligently practicing PPP, then you will know that there's a transition. Okay? So what's the transition? If you have been checking your own box and you are okay as a woman, what about your partner? We need to check the sperm count. We need to check the motility. We need to check the morphology. Okay, so that's what we need to do. So the problem of pregnancy is not only about the woman. The man is also involved. So how can we better improve our chance if we want to have a baby from both parties? Okay, guys, I actually have 3 more minutes because I have another meeting coming up on top of the hour. So I'm not going to spend 1 hour. So let me see what I have. Okay, how possible is it for someone with high blood sugar and high blood pressure to be pregnant? Both of them are not going to stop you from becoming pregnant. You can still become pregnant if you have high blood pressure or high blood sugar, but we need to control them. If we don't control them, they can complicate your pregnancy, so you can have problems, your baby can have problems, you can have problems, and we don't want that to happen. So if you already have high blood pressure or high blood sugar, make sure it's properly controlled before you become pregnant. Okay, guys, quickly, let's knock this off so we can all go and get something done for the weekend. Okay? Can a first-time mom deliver a baby weighing 4.0? Your delivery method, my sister, is dependent on the progress of that pregnancy, okay? So 4.02 is a big baby, right? Now, the criteria that will determine if you're going to have VBAC, and it's VBAC. My sister, come on, please go and prepare yourself for CS. VBAC means vaginal birth after CS. So many women have lost their lives because of stupid delivering like Hebrew women. And you're first-time mom, okay? So be careful. Now, if you're a first-time mom, I'm actually confused. If you're a first-time mom, so what happened to the first baby? Because VBAC means vaginal birth after CS. So does it mean you lost your first baby? So you need to be careful. Okay, so go and follow the instruction of your ANC doctor. Okay, guys, let's see what we have. Okay, Dr. Ndiche is also in the house. Thank you so much, Dr. Ndiche. Unfortunately, when we don't see the gestational sac, it means you have what we call an embryonic pregnancy, blighted ovum. For every woman that is pregnant, we need to see the gestational sac and the pole and the heartbeat. Unfortunately, you've lost that baby. Okay, let's continue, guys. What can you do to increase your eggs? You cannot increase your eggs. Your eggs are fixed. Every month you lose 1 egg, you keep depleting your egg reserve. Now, if you live healthy lifestyle, you can improve the quality of your life. So if you're drinking water, if you're avoiding alcohol, if you're avoiding smoking, if you're watching your body weight, if you're avoiding stress, then the eggs that God gave you, you can use them. But be careful. When you get to 35, your fertility will drop. Okay? Its ovarian reserve test are same as hormone imbalance test. Ovarian reserve test is actually done by checking 2 hormones, anti-Mullerian hormone, AMH, and FSH. So they are hormonal tests. So hormonal imbalance test is a kind of an umbrella. Okay? So under that umbrella, we can check your AMH and we can check your FSH. Okay, guys, let's see what we have. Okay. Guys, we need to wrap up. My time is actually up. And hopefully you're going to attend the event tomorrow. If you want to attend free of charge, go and participate and you might be lucky. Okay, let's see what we have. Let's actually wrap up. Dr. Ndiche is also providing feedbacks. Okay. After fibroid surgery, how long will it take to start fertility treatment? Piggyback to the doctor that gave you the myomectomy. Don't be in a hurry when you've had surgery. You need to recover in your body, you need to recover in your mind, you need to recover in your spirit. So piggyback to the surgeon. Your surgeon will give you a clear order to continue. What might be the cause of low abdominal pain after 2 weeks of miscarriage? Now that's part of the clearing process. So as the contents of a miscarriage is going on, it's not unusual to have cramping here and there. Piggyback to your doctor and hopefully we'll give you some painkillers. And we also make sure you've expelled all the contents of your baby from your body. Some women will have retained product of conception. We need to bring out everything from your body, okay? All right, guys, let's see what we have. Okay, what about one with very large fibroid? For all questions about fibroid, register for the event tomorrow. Stop cutting corners, okay? All right, let's see what we have. You're asking what is the meaning of reboot surgery. I don't know what you mean by that. We have, maybe you're talking about robotic, right? So robotic surgery means we are gonna empower a machine. We're gonna empower someone that is not an individual, more like a computer to carry out the surgery. It's called robotic surgery, okay? So I wanna believe that's what you're asking about. Okay, guys, I'm gonna be wrapping up now, okay? Can scan show when a woman ovulates? We can track the follicles. Somehow you can, okay? Let's see. What causes delay in conception after undergoing ectopic surgery 2 years and you've done so many tests? The problem can come from you. The problem can come from your partner. But remember, my sister, if you've gone for ectopic surgery, you now have a lot of things to contend with. You now have only one tube. So you should be careful. If you've had a ectopic pregnancy last 2 years, I don't see the reason why you're wasting time. Please go and consider IVF because your tube is down. You now have 50% of using the other tube to become pregnant. So consider IVF and on time, okay? All right, guys, let's see. Okay. Can a man with 60% sperm count get a woman pregnant? Yes. Even when it's lower, you can. Okay. First time mom, okay, I've already answered to that. Okay, so I believe I've attended to all the questions. Okay, let's see. Hi, doc. For a woman that is still seeing discharge, please advise, see a gynecologist immediately. You are not supposed to be having any foul-smelling discharge, blood change, or a lot of discharge. Discharge is a fact that maybe you might have infection or inflammation. Okay, guys, I'm done for the day. Thank you for coming. I'm gonna go get some break for another meeting. You see, I've never really had any break, even on weekends. It's crazy out here. But how do you register for the event tomorrow? Follow the admin. Admin is gonna tell you how to register. The deadline is today. Make sure you attend this event. Oh, make sure you attend this event. You have yourself to blame if you don't attend. Okay, guys, I'm gonna go now. Thank you so much. Remember, we are in Facebook. You can follow my timeline. You can follow my page. You can follow my group. Then you can go to YouTube. We are gonna award 15 free attendants for the event tomorrow. What do you need to do? Please go to YouTube. When you get there, click the link for our group. The name of our group in YouTube is Snowspirations Global Health Channel. Okay? Click there. Subscribe. Take a screenshot of your subscription. Send it as an attachment to the post in the group or the page. Then admin will likely shortlist you. Then you can attend the event tomorrow free of charge. There are some women that donated money to enable women that might not be able to have enough money to attend the event free of charge. This is what we do as a group. Okay, so thank you so much. I love you guys and God bless you. And please, I'll see you tomorrow. Admin, thank you so much. Dr. Nietzsche, thank you so much. So I will see you guys tomorrow. Until I see you, God bless you.